Today on the deep dive, we are tackling a joint that causes so much trouble for so many people. Pain, frustration, losing independence. I'm talking about the knee.
Mm-hmm.
We often think knee pain is just, part of getting older. But we're going deeper today. We're looking at just how complex this thing really is.
And it's really vital we do that because anyone who's had serious knee issues, maybe an injury or osteoarthritis creeping in, they know what it means to lose basic function.
Yeah, simple things.
Simple things, walking comfortably, standing up without thinking about it, helping family members. You just don't appreciate your knees until they start causing problems.
Absolutely. So we want to give you a bit of a shortcut to understanding why they fail. Our sources suggest the knee is, well, often really misunderstood. It's not just a hinge.
No, definitely not.
So our mission today, explore that complexity, uncover the surprising truth about where the pain really comes from, and crucially, talk about why rest might actually be the worst advice for an arthritic knee.
That's the core message, isn't it? The sources show the knee is this incredibly fine-tuned system. If just one little piece fails, the whole biomechanical structure starts to unravel.
Wow.
So we'll explore the best ways to manage it, maybe even regenerate parts of it based on how it actually works biologically.
Okay, let's unpack this then. Starting with that complexity. You said it's the most complex joint in the body. Why? What makes it such a marvel, but also so vulnerable?
Well, it's complex because it needs to do two opposite things, really. Provide massive stability, think about the loads it takes, but also huge flexibility for running, sitting, twisting.
Right, stability and movement.
Exactly. So if we break it down, let's start with the bones. There are 4 involved.
Okay, I think most people know 3, right? The thigh bone, the femur up top, the shin bone, the tibia below, and the kneecap, the patella, sitting out front. What's the 4th, and why don't we usually hear about it?
The 4th one is the fibula, sometimes called the peroné. It runs alongside the tibia. And while it's not technically part of that main weight-bearing surface, its biomechanical influence is massive. It affects stability, how the lower leg moves.
So if something's wrong with the fibula, like alignment.
Absolutely. If you've got a fibula issue, maybe an alignment problem or a muscle imbalance pulling on it, you will definitely feel knee pain, even if the main joint looks okay on an x-ray.
That's huge. So the pain source isn't always in the knee joint itself.
Precisely. It highlights that referred pain idea. Now let's go inside the joint proper. You've got the menisci.
Big cartilage pads?
Yeah, 2 big C-shaped cartilage pads, one inner, one outer. They're like shock absorbers. Then you have the crucial stabilizing ligaments inside the cruciates.
Anterior and posterior, ACL, PCL.
That's them. They stop the tibia sliding too far forward or backward on the femur. Absolutely critical wires.
And all this delicate machinery is sort of contained.
Yes, exactly. It's all wrapped in a large articular capsule, like a tough bag. It's filled with synovial fluid for lubrication, then reinforced on the sides by collateral ligaments.
And then you have everything else around it.
Right. A whole ecosystem.
Yeah.
Big muscles like the quads, hamstrings, calf muscles, plus all the veins, arteries, nerves. It's an incredibly crowded, complex neighborhood designed to work in perfect harmony.
But when one thing goes wrong,
The whole symphony falls apart. Even slight wear or a small tear, it immediately disrupts the balance.
which brings us perfectly to section 2, and maybe the biggest surprise, the osteoarthritis paradox. We call it osteoarthritis or arthrosis, the wearing down of the joint surfaces. And we assume wear equals pain, bone on bone grinding, right? But the sources say the wear itself isn't actually hurt. How does that work?
Yeah, it's fascinating. Arthrosis is the mechanical breakdown. The degeneration of cartilage is fundamentally a painless process. Why?
No nerves.
Exactly. The cartilage that's wearing away doesn't have nerve endings. So the terrible pain people feel, where does that come from? It's the inflammation generated around the arthritic joint.
Ah, okay, so it's the body's reaction to the wear, not the wear itself causing the sensation.
Precisely. Inflammation is the body's alarm system, yes, but it's also inherently part of trying to repair the damage.
Yeah.
It signals regeneration attempts. Now, if we ask what causes the wear to accelerate, we have to talk about weight.
Overweight, obesity, big factor.
Huge factor. But the sources make a really important distinction here. It's mainly the acquired overweight or obesity that's the problem.
Meaning putting on a lot of weight suddenly versus someone who's always been heavier.
Correct. Someone who is naturally, say, larger framed often has bones and joints that have adapted over their lifetime to carry that load. They might have denser bones, stronger ligaments.
The structure matches their build.
Right. The real trouble starts when you suddenly put, say, 50 extra pounds on a frame that wasn't designed for it. That overload accelerates wear and tear dramatically. You often see meniscal tears happen much faster then.
Okay, that distinction makes sense, and it leads to that key mystery the sources bring up, the age and weight puzzle. You have the classic example, the 85-year-old patient. They ask the doctor, okay, my left knee is shot because I'm 85. Fine, but my right knee is also 85. Why doesn't it hurt?
That's the million-dollar question, isn't it? It separates just diagnosing wear from actually understanding knee health. If both knees are the same age, carry the same weight, why does one fail and the other keep going?
And the answer, you said, is counterintuitive.
It is. The scientific answer, often missed, is all about how the knee gets its nutrition.
Nutrition. Into the joint. How?
Through the cartilage.
Exactly. It relies entirely on the cartilage. Now, cartilage, if you look at it like in a butcher shop, it's white.
Right, not red like muscle.
Because it's a vascular, no direct blood supply. So how does this tissue, under constant pounding, get nutrients to survive, to repair itself? It uses this amazing ancient mechanism called imbibition.
Imbibition. Okay, sounds technical. Can you break that down?
Yeah, think of the cartilage like a sponge. It's soaked in that synovial fluid, which is full of nutrients. Since there are no blood vessels in the cartilage, it needs a pump. And the pump is movement.
Mechanical stimuli.
Yeah.
Walking, running, any impact. When you load the joint, you squeeze the cartilage sponge. That pushes out waste products and deoxygenated fluid.
Okay, the squeeze phase.
And then when you lift off, release the pressure.
The sponge expands back.
Exactly. That's imbibition. The release creates a slight vacuum, and the cartilage sucks in fresh synovial fluid, bringing oxygen and nutrients from the surrounding tissues. Squeeze, release, pump, no pump, no food.
Wow. That completely flips the script on the usual advice, doesn't it?
It really does.
Because what do doctors often tell people with osteoarthritis? Stop running, stop jumping. Maybe even just rest more, don't walk so much.
And that, according to this understanding, is a critical error. Because stopping all impact, it shuts down the nutrient pump. You literally starve the cartilage.
Which explains why people often feel more stiff and sore after resting, like getting out of bed in the morning?
Precisely. The joint's been static, no pumping action for hours. It's crying out for nutrients.
So the right approach isn't total rest, it's targeted movement.
Targeted, pain-free movement. You need to stimulate that biomechanical pumping action, but stay within a range that doesn't cause sharp pain. Keep the nutrient flow going.
And this pumping relies heavily on the surrounding structures. The muscles.
Absolutely. The muscles are key.
Quads, hamstrings, calf. They aren't just for strength then. They're part of this nutrient delivery system.
Yes, exactly right. They provide stability, power movement, sure, but their contraction and relaxation drives that pumping action, helps move fluid. And they also play this other fascinating role in managing inflammation.
How so?
Well, when there's significant inflammation, lots of excess fluid builds up in the joint capsule, these big, powerful muscles around the knee. Their sheer contractile force can actually pull or squeeze some of that excess fluid backwards out of the main joint space.
Pull it backwards. Where does it go?
It tends to accumulate in the hollow space right behind the knee. It's called the popliteal fossa.
And that collection of fluid, that's a Baker's cyst.
That's exactly what a Baker's cyst is. So it's a really important insight. The cyst isn't the root cause of the pain. It's a consequence. It's the body trying to manage the overflow of inflammation from the arthritic joint itself.
Amazing. The body trying to compartmentalize the problem. Okay, so knowing all this, the complexity, the inflammation issue, the crucial role of movement, how do we build a long-term strategy? What actually helps?
Well, the strategy needs 3 core pillars based on everything we've discussed. Pillar 1, stimulate that mechanical movement, the pumping, within pain-free limits, yes. Pillar 2, strengthen all those supporting muscles. Quads, hamstrings, glutes, calves. Stability is key.
And pillar 3?
Address nutrition and weight, but carefully.
Right, you mentioned acquired weight, so weight loss helps.
Yeah.
But you also stressed increasing muscle mass, not just crash dieting.
That is absolutely crucial. When we say lose weight, we mean lose excess fat mass. At the same time, you ideally want to increase lean muscle mass. Muscle burns calories, provides that vital stability, and helps the nutrient pump. Starving yourself with crash diets often leads to muscle loss, which is counterproductive. Avoid malnutrition.
Makes sense. And what about the nutrition itself? Anything specific for joints?
Yes, very specific things help. First, general principles: eat real food, cut down massively on refined, processed stuff, And space out your meals.
Fewer meals.
Yeah, maybe 2 or 3 well-spaced meals a day max. Give your body time between eating for cellular repair processes like autophagy. For joints specifically, focus on foods rich in short-chain fatty acids.
Like what?
Think oily fish, what's sometimes called pescado azul or blue fish, salmon, sardines, mackerel, herring. Those omega-3s are building blocks that really help the body manage inflammation and support joint tissue regeneration.
Okay, good practical advice. Now the tough question. We're talking management regeneration, but can osteoarthritis actually be cured?
Look, realistically, no. Arthrosis, the actual wear and tear on the cartilage surface, isn't reversible in the sense of making it like new again. That damage is generally permanent.
So the goal isn't a cure.
The goal is improving function, maximizing the health of everything around the worn area, the muscles, the fluid, the capsule, and critically stopping or drastically slowing down further degeneration.
Right. Managing the situation, maximizing quality of life. Okay, let's touch on medical interventions. Sometimes people get quick fixes, cortisone shots, for example. What's the thinking there?
Corticoid injections. You need extreme caution. They are powerful anti-inflammatories, no doubt. That's why they can dramatically reduce pain, sometimes very quickly.
It sounds great.
It sounds great, but remember what we said. Inflammation, while painful, is linked to the body's repair process. So when you blast it with strong anti-inflammatories like corticoids, you're also effectively hitting the brakes on regeneration.
Ah, so short-term gain, maybe long-term. Pause on healing?
Exactly. Plus, repeated injections can actually damage surrounding tissues over time, cause fibrosis. They should really be a last resort, not a go-to solution.
And what about surgery? Sometimes they talk about cleaning up the joint, trimming cartilage.
Similar caution applies. Those cleanup surgeries, arthroscopies to trim frayed meniscus or file down rough spots, the results are mixed. Sometimes they help, sometimes they don't. And sometimes they can actually further disrupt the joint's delicate biomechanics. Again, the approach should always be to try natural, non-invasive methods first. Exhaust those options.
Okay, so let's pivot to those natural supports and maybe more advanced regenerative treatments. Supplements are huge. Collagen is everywhere. Does it work?
Collagen can work, but there are big caveats. The absolute star, if you're going for it, is hydrolyzed collagen. That word hydrolyzed is critical because collagen is a huge, complex protein molecule.
Yeah.
Just eating plain collagen. Your digestive system really struggles to break it down into small enough pieces to actually absorb and use effectively. Hydrolyzing predigested breaks it into smaller peptides. Double hydrolyzed is even better.
So look for hydrolyzed, but you mentioned another huge caveat, even with the right type.
Yes, and this is maybe the most overlooked factor. You can buy the best, most expensive hydrolyzed collagen.
Yeah.
But if your gut health, your intestinal barrier isn't working properly, it's basically useless, a waste of money.
How so?
If you have poor digestive quality, maybe leaky gut, your body won't see those collagen peptides as foreign invaders, not absorb them properly, and just eliminate them. You've got to fix the gut first for any supplement, including collagen, to work optimally.
That's a massive takeaway. Gut health first. Okay, besides collagen, any other key supplements?
Well, the classics are glucosamine and chondroitin sulfate. There's also interest in specific peptides designed to target cartilage and bone cells, the osteoblasts. But another really essential combo is vitamin D3 with vitamin K2.
D3 we know is important, often called the sunshine vitamin, acts like a hormone. Why K2 specifically with it?
Okay, so D3 is brilliant at helping you absorb calcium from your food. But once it's absorbed, calcium needs directions. Like, where should it go?
Ah, K2 is the director.
K2 is the director. It helps ensure that calcium gets deposited where you want it in bones and teeth and not where you don't want it, like in your arteries or soft tissues where it can cause calcification.
So for joints, it helps strengthen the bone component.
Exactly. Better bone mineralization around the joint helps reduce wear and friction pain. It's a crucial partnership, D3 and K2.
Got it. Now, moving beyond supplements, if someone has a confirmed diagnosis, significant arthrosis, what advanced interventions might a specialist discuss? Things that promote regeneration.
There are two main ones often cited. First is PRP, platelet-rich plasma.
Okay.
It sounds complex, but it's actually quite simple. They draw a small amount of your own blood, spin it down in a centrifuge to concentrate the platelets. Those are packed with growth factors.
The body's own repair crew.
Pretty much. Then they activate those platelets, sometimes using things like LED light, to make them release their payload of repair factors. This concentrated solution is then injected right back into your knee joint. Often they mix it with ozone too for extra anti-inflammatory punch.
Using your body's own healing potential, what's the second option?
Hyaluronic acid injections. This is a substance naturally found in synovial fluid. The idea here is basically to re-lubricate the joint.
Like adding oil.
Sort of, yeah. It helps restore some of the lost viscosity, reduces friction, and might provide some direct nutrients within the joint space itself.
Okay, both sound promising. But with both PRP and hyaluronic acid, they involve putting a needle into the joint capsule. There must be a safety warning there.
Absolutely critical. Anytime you breach that joint capsule with a needle, there is a risk, however small, of introducing bacteria. A joint infection is serious, really serious.
So sterility is paramount.
Non-negotiable. Strict sterilization protocols performed by a skilled specialist. It's absolutely mandatory. Cannot be emphasized enough.
Understood. Well, this has been incredibly insightful. We've covered a lot. But the core message seems clear. Managing knee health, especially with osteoarthritis, isn't about putting your feet up. It's about intelligent maintenance.
That's it.
Those 3 pillars you mentioned. Movement, that crucial pump for nutrients via imbibition, strength from the surrounding muscles for stability and support, and targeted nutrition providing the right building blocks, like hydrolyzed collagen if your gut is healthy, and that D3K2 combo.
Exactly right. And maybe here's a final thought, something provocative for everyone listening to mull over.
Okay.
The human knee is ancient technology, right? It evolved over millennia, designed to be maintained by constant movement, walking, running, squatting, climbing, the activities of our ancestors. Now think about our modern lives. Hours sitting at desks, in cars, technology doing the physical work for us. We've largely removed that constant necessary mechanical stimulus. So the question is, how are you consciously going to reintroduce that stimulus every single day? Are your current habits actually feeding your cartilage? Or are you, perhaps without realizing it, letting your body's most complex joints slowly starve?
A powerful question to end on, something for all of us to think about and, more importantly, act on.